Hello, this is Dr. Gay from First Lake MRI, and this is a quick case to test your abilities. And here we go. Just have one image here to look at this and see, can you make the diagnosis? This is a wrist. They did have trauma recently, and that's all you need to know. So if you look at this is the dorsum of the wrist, palmar aspect, radial aspect, ulnar aspect. We can tell it's the ulnar aspect because we have the ECU, the extensor carpi ulnaris, and go. Okay, great. Okay, here we go. So this is the radial side. On the radial side, we should see the abductor pollicis longus, the extensor pollicis brevis, and here we have the extensor carpi radius longus and the brevis together. And normally we see the extensor pollicis longus going over the top here someplace. I just don't see it on this. And sometimes it's really small, really hard to see. We just don't see it. Again, it goes longus, brevis, and then longus again, depending on where you are. So I'm going to go up and down and see if I can find it. And again, it should be going across here. I just don't see it. If we go on up, have a hard time. Let me go down, down, down. Now I see a little bit of fluid here. Looks kind of funny. That's where it should go. And fluid, and there it is. So it looks like this thing is completely torn and retracted back. This is the extensor pollicis longus tendon. There's the torn end over the radial metaphysis, and there's fluid. And we're going to go up. It should go right through here. It should go across here. Again, we don't see it. We just see the fluid. We also see little injuries of these tendons. This looks a little irregular here. This is irregular, so these got lacerated as well. And then here's the torn end distally. So here's the extensor pollicis longus distally. And we're going to follow this back to watch it disappear. There it is. There it is, maybe to right there, and then gone. So lacerated, this is retracted superiorly, and the proximal end is retracted back down into the wrist, right there. Looking on this view, we're going to try to find that, and here it is. This is the tendon, comes up to the wrist, ends right there, and there's that fluid pocket, and the distal end is right here, recoiled, and there's a torn end right here. And that's it. Thank you so much.